We're going to continue with Chapter 7, Shock, in this second part of the chapter with understanding what to look for when we're talking about shock. There are different signs and symptoms. If you notice that somebody's mental status is not what it normally is, they seem out of it. Maybe they're pale or clammy. They have blue lips or their nail beds. That means they're not getting enough oxygen. They may be nauseous or vomiting, or they have a rapid breathing and heart rate. They might be unresponsive when the shock is severe. So these are things you have to pay attention to. And what do you do if someone is in shock? First, you have to treat injuries. If there's a certain injury, if there's bleeding, you have to treat that injury. If the person is responsive and they're breathing normally, keep them flat on their back. And if there is no sign of injury, elevate their feet about a foot. If they're unresponsive, you need to roll the person onto their side, and you want to prevent loss of body heat, so possibly cover them with a blanket. Call 911, but do not give them anything to eat or drink. Anaphylaxis is a situation that can progress rapidly. You have to look for signs and symptoms. Shortness of breath, swelling of any part of the face, tongue, mouth, nose, a lot of itching, flushed skin, sneezing, coughing, or wheezing, any type of swelling in the throat, feeling like the throat's closing up, or tightness in the chest, in addition to an increased or rapid heart rate, turning blue, feeling dizzy, a history of previous severe allergic reactions, and if they're wearing some type of, or they're carrying a medical identification tag stating they're allergic to penicillin, for example. Well, what happens if someone is having an anaphylactic reaction? Obviously, first thing, call 911, monitor their breathing. If they have an epinephrine auto-injector, you have to help administer that. If the person can swallow, you can give them an antihistamine. These are things that will help immediately until further help arrives. When you're using an epinephrine auto-injector, basically, it's a very simple thing to do. You just take the cap off. There's a safety cap. Find the outer section of the mid-thigh, because that's where you're going to inject it. You're just going to really just punch that injector right into the thigh, and you're going to leave it there for about 10 seconds and then pull it out straight. Don't pull it out at an angle because that could hurt. You want to just pull it out straight and rub the area for about 10 seconds. Sometimes there's mild allergic reactions. They're not as severe as an anaphylactic reaction and don't need to activate EMS and get the person to the hospital. Remember, when somebody is having an anaphylactic reaction, you can help them with an antihistamine or an EpiPen, but that is not where it stops. They still need to get to a hospital for further treatment. But if it's a mild allergic reaction, maybe somebody has red or itchy eyes and sneezing, or their nose is itchy and running, they may have a little rash on the skin. This is nothing of severe severity that could take their life, but you can help them administer. If it's an asthma attack, help with the inhaler or have them take an antihistamine. Fainting is another thing that can happen when someone is in shock. So if a person suddenly collapses, check their breathing. If the breathing stops, call 911 and start CPR. If the person is breathing, keep them flat on their back, monitor the breathing. If it stops, begin CPR. Check and treat any injuries that occur, and wipe the person's forehead with a cool, wet cloth. That just helps them to feel a little better and keeps the body temperature down. If the person is about to faint, you want to try and prevent a hard fall. So if you see someone is about to faint, you want to catch them so that you prevent them from smacking their head on the ground. If you feel faint, lie down or sit down. Do not place your head between your knees, but just sit and lie down until you're feeling better. So these are just some tips when somebody is in shock. This is a quick overview. Again, remember, read your chapters, watch the full or read the full presentation on the PowerPoint slides, where you can really understand what's going on. But reading the chapter and any resource materials that are included with the chapter are very, very helpful in understanding the information.